pride ourselves in the exceptional care that we give. This is a story of 5 people that came to us for help. Not only did we help change their smile, we actually helped change their lives.
The problems prior to the dental programme, loss of teeth, dental bridges that didn't work, gum recession, numerous abscesses, which all affected my personality, my well-being, at a time when I really felt, it was demoralising, really.
Over recent years, I've lost bone in my lower jaw, and I had a nerve exposed.
I started to have problems with some teeth that were loose, and my dentist said there's gum disease there, unfortunately. Looks like you're going to lose some teeth.
If you've ever been a denture wearer, you know that the bottom denture never fits perfect and it's uncomfortable eating, sore patches on my gums.
And when I used to bite on my dentures would touch the nerve and give me rather a lot of face pain.
The opportunity to meet Mr. Pugh and to undergo this treatment plan, which involved an implant retained denture. The process was long, but throughout the whole weeks or months that it took, I was fully supported by every member of the team.
So I have implant retained dentures in my lower jaw and just a full denture at the top.
6 years ago I went to see John, and he worked very hard to save the tooth that was loose, and unfortunately he couldn't, but he did some bridge work and it's been absolutely fantastic.
When Jan first came to see us, she was extremely nervous and constantly holding her hand in front of her mouth when she was speaking. And I was just really excited and hoped that she would go ahead with what we recommended, because I knew that it would make a huge difference.
Both surgeries were absolutely smashing to be under, Nothing was too much trouble for either of them. They were both very good. The staff was all very, very pleasant. I just can't speak highly enough, for what I've gone through and what they've done for me.
I can eat an apple straight out of the fruit dish, which I haven't done for 30 years. They're very comfortable, my pain is gone, and life is good. And, I don't have to think about if I'm going out to eat anywhere. I can just eat what I want when I want. And it's made a big difference to my life.
I wished I'd known about Steve years ago. I wished I'd known about Steve when I had problems before I had my teeth out, because they could have saved them from what I've heard. It's just given me so much confidence now, it's unreal. And the day I had the new dentures fit, Steve put them in, stood back with it, went to get a mirror, and he turned round and he said, "They look good," and I looked at you.
Yeah.
And the way you looked at me, I knew they were good. It made me cry.
Hi, ladies and gentlemen. How's everything with your meal?
Absolutely
Good.
Absolutely. Thank you very much. Great stuff. Yeah.
Betty came to me with a history of loose dentures. The lower denture particularly was a problem, and she had a lot of pain with that she described as neuralgia. So I referred her to my colleague John, and he assessed the case to see whether she was appropriate to have dental implants placed.
Yeah, Betty was very borderline. She had a very, very resorbed lower jaw, and the pain she was experiencing was from nerve compression. When she bit down, her denture was pinching a nerve in the lower jaw. So by placing the implants, we were able to stabilise the denture and prevent the nerve compression.
Betty was then referred back to us at the Denture Clinic, and we completed the case and made Betty a beautiful set of teeth. She can now smile, she's confident, she can eat well, and Betty's a much happier person.
One of the other patients that we've been spending our time with this evening was Betty's sister, Lee. After Betty's treatment was completed successfully, she recommended her sister to come and see us. and again we provided a couple of dental implants for her and referred her back to Steve.
Lee's case was an excellent case for John because he could place the implants perfectly, which gave her great stability. We completed the case and gave her the smile she always wanted, and now the function that she wanted also.
Another one of the ladies we were talking to this evening, Sylvia, hasn't been treated with dental implants. She self-referred to our practice because she was aware that her teeth were becoming more mobile. But we were able, with treatment from my colleague Mr. Carl Horton, to stabilise her gum condition. She was very pleased with what we'd achieved for her and recommended that her sister Anne came to see us as well. Sadly, Anne's gum disease was far more aggressive and far more advanced, and we didn't have the option to treat her gum disease, so we had to extract all of her upper teeth. I then placed 4 dental implants and referred her on to Stephen for the completion of her treatments.
Anne came to me with her dental implants complete. We gave her the smile she wanted and the functionality she wanted, and she's a very happy person now. Jan was a great success, even though she wasn't able to have dental implants. We made her a high quality set of teeth, gave her the smile she always wanted. She's a very happy lady.